Thank you for visiting our Vascular Diagnostics section of our website. In addition to being experts in the field of vein care, we are also experts in the field of non-invasive arterial and venous evaluations. Vascular Diagnostics allows us to provide accurate physiologic diagnosis of arterial and venous problems in our patients. I make the distinction between physiologic and anatomic, so I think it's important. Clearly, what matters most to patients and physicians is what's going on physiologically. That means in real time. CAT scans and MRIs and these fancier, more expensive, more invasive tests are typically the knee-jerk response of many physicians and patients these days. They want the latest technology, which often isn't an ultrasound, but a fancier test, an MRI or a CT scan, which provides not physiologic information, but more anatomic information. What doesn't make sense as a vascular surgeon in many times is to have this anatomic picture of something, of a patient's arteries or veins, without the physiology to explain what we're seeing. So when we approach our patients, we're approaching them from a physiologic standpoint. We use ultrasound technology. We can apply this technology to the carotid arteries in terms of screening patients who have had symptoms of a stroke or mini stroke, or may have a noise in their neck called a bruit that needs to be investigated to determine whether or not there was a significant blockage there that may need further evaluation or treatment. We can use the same ultrasound technology to examine our patients with venous pathology. That is, those patients with varicose veins, swollen achy legs, restless legs, venous ulcerations, or bleeding from their varicose veins, to determine exactly where the problem is, whether the problem is in the veins that we can fix, which is usually the case, or whether it's in deeper veins or connecting veins that may require a little bit more complicated or more measured approach. So the same technology, ultrasound technology, using modern equipment to diagnose both arterial and venous conditions and make decisions about what treatment best fits that patient. Using ultrasound technology again in the office setting as an outpatient without any special prep required or any intravenous medications administered, we can examine our patients and determine whether or not there's an aneurysm of the abdominal aorta present, and if so, what the size that is and what sort of risk that poses to that patient, both immediately and in the future. Other types of aneurysms that we may encounter on routine ultrasound examinations of the veins include aneurysms of the femoral artery in the groin area, or of the popliteal artery behind the knee. Our objective at vein specialists is to be experts in field in the diagnosis and full management of patients with venous insufficiency. In addition, we also have the unique opportunity to be experts in field and in the field of non-invasive vascular diagnostics. And we do provide a full range of non-invasive vascular testing. But we are uniquely qualified, uniquely situated, I think, to provide these services with our registered vascular technologist, J.T. Gerard, and myself, Dr. Magnant, as a board-certified vascular surgeon with a wealth of experience both in treating arterial problems and in treating venous problems here at Vein Specialists. So the question is, why did we set up Vascular Diagnostics as a center? And I think the crux of the issue is to provide patients and physicians with a one-stop shop, so to speak, for all their non-invasive arterial and venous evaluations. We are solely committed to performing accurate, non-invasive evaluations of patients' arterial and venous problems. In addition to the studies I've discussed, there are other indications and studies that we do perform. If you have any questions at all, please feel free to contact us. I'd be happy to answer any questions that you have regarding arterial or venous studies or arterial or venous conditions. For referring physicians, this is a great opportunity for me to serve as your resource. Vascular Diagnostics is committed to providing the most expert and comprehensive evaluation of arterial and venous disease. And I encourage you to call me, to contact me through my office or through the website if you have any questions at all about what study to order for which patient at what time. If we happen to find arterial pathology while we're doing a venous study, I'll be certain to communicate that to you immediately, and then if need be, help you with the decision making in terms of who to refer that to or what the next line of treatment should be. So thanks for visiting Vascular Diagnostics. Again, I want you to feel free to contact me with any questions that you might have.